What we're going to talk about today is the importance of actually planning for a pregnancy. And it's really important to understand that pregnancy isn't about one or other partner in particular, it's about both people in the relationship. So we're going to talk about a range of things today that are important for people who are planning a pregnancy. One of the questions we would get asked very frequently is how important is timing of intercourse? And lots of couples will spend a lot of money buying various kits to help them time their intercourse, using phone apps, and trying to get the timing absolutely spot on for ovulation. And for lots of women who have a cycle that's a little bit variable, maybe some cycles are 26 days, some cycles are 30 days, it can be a bit of a problem. So what we say is just look at 6 months of cycles. Mark the first day of your period on your app or your calendar, and then calculate from the first day of one period to the first day of next. And if you have cycles that vary between, say, 28 and 32 days, take 14 off of 28, take 14 off of 32, and you've got a window in there which is day 14 to about day 18. And then start on day 13 and just have alternate day intercourse. It's just not necessary to have intercourse every day. You can if you want to, but when people are trying to have a baby and they've been trying for a few months and it hasn't worked, kind of the pressure really gets to them after a while. What lots of couples don't know is that sperm have quite a long survival time. So when you've had intercourse, that sperm stays alive in the cervical glands for up to 5 days. So by having intercourse on alternate days, then that more than covers your ovulation time. Now we say watch for cervical mucus. Now your cervical mucus increases as the follicle grows in your ovary. The egg is contained in your follicle. But some people don't actually notice their cervical mucus. It's sort of really clear and stretchy and like egg white. Don't panic if you don't see it. It just means that you've probably only got a small amount of mucus and it's in the cervix that you can't see. And as we said, every alternate day to have intercourse is absolutely fine. One of the things that's really, really important about planning your pregnancy is to understand that what happens prior to conception is going to have a really big influence on the health of your baby going forwards after your child is born. So that if your dietary habits are poor in that 3 to 6 months prior to conception, then there is a very good chance that you will be predisposing your baby to a series of illnesses or health abnormalities, which can include high blood pressure, diabetes, and early onset of cardiac disease in their 40s. So if we're talking about a good healthy diet, what I say to my patients is just think that you want your child to have a really healthy diet. So what you're doing is getting prepared in advance. So the 5 fruit and vegetables rule applies. Protein is really important. And so we talk about good quality protein. So that could be lean meat, could be red meat, it can be white meat, fish, eggs, beans, lentils. It's really important. And for some people, if they're vegan or vegetarian, it can be quite useful to consult a dietitian to actually find out, are you getting enough of each of the food groups in your diet? Lots of people cut complex carbohydrates out of their diet, especially if they're trying to lose weight, and that's not a good idea. You do need some complex carbohydrates, and ideally in your bread intake, if you have whole grain bread rather than white bread. Plenty of calcium. Looking at the food additives, try and stay away from food that's really highly processed. Just use your unprocessed foods, your good vegetables, and that's much better for you. Additionally, we would always recommend that women take a folate supplement. Folate is really important. It's important in the development of the nervous system of your baby. And we know that some women carry a particular gene which makes it hard for them to metabolise folate properly, and they need extra folate. And we know that by taking supplemental folate, such as Blackmore's Pregnancy Gold or Elevate, decreases your chance greatly of having a baby with spina bifida. So we advised stick to a low GI diet, don't cut out complex carbohydrates, don't cut out fat. Some fats your body can't make. It is really essential to have the good fat. So that's olive oil, avocados, nuts. Weight is really important. A normal healthy body mass index, which is calculated according to your height and your weight, is a body mass index of 20 to 25. And we know that if your BMI is above 25, you are overweight. It's termed obese if your BMI is more than 30. And equally, if you're underweight, there are problems. We know that the rate at which people conceive will be greatly influenced by their BMI. And this is as important for men as it is for women. We know that obese men have increased damage to their sperm because of their obesity. Lots of research we've done shows that even a small weight loss, 3 to 5 kilos, can increase your chances of conception and successful ongoing pregnancy. Fitness is really important, and it's a question of getting the balance right. We don't want you to have excessive exercise. Some research has shown that more than 4 hours a week can be detrimental. So dividing that 4 hours across 7 days, a half an hour per day, limit the high intense or high impact exercise, and a moderate level. Weights with your arms are absolutely fine. Walking is great, and the exercise applies for men as well. Smoking is one of these things that we know is truly detrimental. For men, if they're smoking more than 5 to 10 cigarettes a day, we can show that there's what's called DNA fragmentation. So the sperm is actually damaged by the cigarette smoking. That's associated with a reduction in pregnancy rates and an increase in miscarriage rate. Also, erectile dysfunction in men. In women, smoking is associated with a reduction in the total number of eggs that woman has. Men make new sperm every day. Women are born with all of their eggs. So you're born with somewhere between 1 and 3 million. By the time you're 12, you've got about 300,000. You'll ovulate about 350 in your life, and the rest die inside your ovary. And smoking will increase the rate at which you lose your eggs. The other thing about smoking is that women who are pregnant have a much greater risk of their baby not growing well in the uterus. It's called intrauterine growth restriction and miscarriage. As far as alcohol is concerned, we recommend that if you're trying to conceive, that you should stop alcohol. So far as men are concerned, we recommend a maximum of 2 standard drinks with at least 2 alcohol-free days a week. Additionally to that, there's recreational or illicit drugs. There is a group of blood pressure medication called calcium channel blockers, which will affect fertilisation rates. Some antidepressants, obviously if someone has cancer, they're chemotherapy agents. We see quite a lot of men who are taking steroids for bodybuilding, and that's a fantastic contraceptive. It can in fact make the sperm count go to 0. Some antibiotics, caffeine, we recommend less than 200 milligrams per day. And when we're looking at these things, what we see is a direct harm to the testes, again, erectile dysfunction, reduction in libido, and an altered hormone profile. So far as heat's concerned, and men make new sperm every day. It takes about 72 days for the division process and another 18 days for it to get motility. So if someone's having regular hot baths or saunas, I had a patient once who was a builder, and he'd come home every night and have a hot bath, and his bath was so hot his wife couldn't put her foot in it. And it did have a really significant effect on his sperm count, and we were able to just work with him, and he got a normal count back when he stopped his baths. So, you know, sometimes with people, their jobs, they work in really hot environments and that can be really difficult. But if it's possible to avoid that situation, it's good. And the other thing is keep your laptops on the desk, not on your lap. So we touched on the folate, at least 500 micrograms. Vitamin D is also really important. There are a lot of women and men who have a reduction in their vitamin D these days. And the slip, slop, slap programs work so well that we're not getting enough sun exposure to have good vitamin D levels. We also strongly recommend vaccinations. Any of the conditions on the right, rubella, chickenpox, if somebody doesn't have immunity and they have a first infection in pregnancy, that has the ability to be associated with an abnormality of the fetus. So we recommend checking and having a vaccination of rubella and chickenpox if they're negative. Flu vax is really important because we know that if a woman gets flu in pregnancy, it can be really detrimental to her health. Whooping cough is really important. I would also suggest that if you're thinking about pregnancy or you've got a small baby, talk to mum and dad and make sure that their whooping cough vaccination is up to date as well, because you don't want to go to their house with a baby and find that they get whooping cough from someone else, because unfortunately we have a whole group of people currently who don't vaccinate, and that puts everyone else's babies at risk. And in a high risk situation, healthcare workers, consider a hepatitis B if you're in that risk situation. Always make sure your pap smear is up to date. See your local GP to do that, or a women's health centre. And if anyone's over 40 and considering their first baby, consider a mammogram. So there's a series of things that can be associated with infertility. If a woman is not releasing an egg, if her fallopian tubes are damaged, if there's some problem with an embryo implanting, a condition called endometriosis where certain cells grow where they shouldn't, and a congenital abnormality of the uterus. There's something called polycystic ovaries, which people talk about a great deal. There's lots of things on the internet about it. And it's a particular appearance to the ovaries. And about 25% of women have an appearance of polycystic on their ovaries, but the syndrome itself is hard to know exactly what percentage, but probably about 5% of women. And it's a significant cause of infertility. The symptoms that are associated with it could be irregular periods or loss of periods, excessive hair growth on the breasts, on the face, hair loss, acne, obesity and depression. Endometriosis is a funny condition where cells that normally line the uterus grow either in the wall of the uterus, within the pelvis itself, and it puts little plaques or nodules. It's about 10% of reproductive aged women. Many women don't have symptoms and they're not aware of it until it's investigated, but it can be associated with painful periods, painful intercourse, rectal pain, pain when emptying your bladder. So the advice would be anybody that has heavy painful periods should see their doctor for a checkup. Symptom severity doesn't reflect how severe the disease is. Male infertility. It's very common. About a third of the patients we see have male infertility. Low sperm count is less than 15 million in each 1 milliliter ejaculate. Some men don't have any sperm in their ejaculate at all, and there's some medical reasons why that is. Cystic fibrosis is common in our community, and often those men won't have a vas deferens. Sex difficulties, failure to ejaculate, problems with intercourse can be associated with male infertility, and then sperm that have got a funny shape, and we've got a diagram there showing the different shapes that sperm can actually have. They need to be able to swim in a forward direction to get good fertilisation. Increasing age is associated with an increase in infertility. A woman at age 35 has half the pregnancy rate of a 30-year-old, and a woman at age 40 has half the pregnancy rate of a 35-year-old. If we look at men don't realise that their fertility goes down. So if a 25-year-old man has a 25-year-old partner, they conceive in 4 to 6 months. If a 50-year-old man has a 25-year-old partner, it takes them 26 months on average, and that's just male ageing. Infertility is defined as the inability to conceive after a year of unprotected intercourse or the inability to carry a pregnancy to a live birth. And there are lots of different causes. So about 30% is due to female factors alone, around 30% is due to male factors, and the balance is a combination of both male and female factors. And the figure of up to 10% of infertility remaining unexplained is slowly but surely decreasing as we get more sophisticated investigations. 1 in 6 couples are affected. Secondary infertility is where a couple has had one baby or one pregnancy and then they're unable to conceive the second time round. And again, there are a number of reasons why that may be. So what we suggest, if a couple is under the age of 35 and they've been trying for 12 months, then it's a really good idea to seek, at least have a consultation and an opinion to see if there are any significant factors. And if a woman is over 35, we recommend she seek help after 6 months. And then just some possible signs of reduced fertility include irregular, heavy or painful periods, past history of infection, chlamydia for example, recurrent pelvic surgery for endometriosis, recurrent pregnancy loss. So far as men are concerned, if they've had issues with undescended testes or testicular torsion or small testes, or if there's a strong family history. So at Repromed there's lots of different treatments and it depends very much on the cause of infertility. So we do fertility assessments where we look at people's fertility, we monitor their cycles with cycle tracking, we induce ovulation if someone is not ovulating regularly. We can do something called intrauterine insemination, which is where sperm is concentrated and put in the uterus. We can obviously do IVF. Some of our patients having IVF, the men need to have their sperm recovered surgically if there's none in their ejaculate. We do surrogacy, we have donor programs where couples don't have any eggs or sperm, and we do a lot of pre-implantation genetic screening for couples looking for particular abnormalities. If we look at the success rates of Repromed, we are really, really proud of our success rates. So when we're talking about success rates, if you look at this little brown bar here, this is what we call ANZAR data. Now, every IVF unit in Australia pools their data. There's 72 units across Australia and New Zealand, and that's the average pregnancy rate for all of the units. This is Repromed's pregnancy rate for all patients that we treated from 1 January last year to the 31st of December. This is clinical pregnancy means that when you have a scan, we actually see a live pregnancy. Some of those are subsequently lost, and the take-home or live birth rate is 43%. Now, some people think that's not very high, but I need to tell you that natural conception rate is at best about 20% per cycle for the first couple of cycles. It depends on the age. Like for a 40-year-old woman, it's probably about 5% per cycle. So about double natural conception rates. The other thing is this darker green bar, you can see that there is an increase in pregnancy rates, and this is for people who perhaps have had failed treatments, they've got a family history, they've had a history of perhaps Down syndrome and they're wanting screening, and so it's a fantastic advance in reproductive medicine. Medicare requires patients seeing us to have a referral. It's just a Medicare rule. So if you're wanting to talk to someone at Repromed, see your GP or perhaps another specialist that you're seeing and get a referral to Repromed, and we'd be absolutely delighted to see you. We just do basic fertility health checks for men and women, and the cost shows there, $85 for a single or $135 for a couple, which includes a 45-minute consultation with one of our fertility experts. So we would like to wish you all a happy, safe and successful journey, and may all your dreams come true. If you'd like to talk to one of our staff, pop over to stand G30, which is just over there, and I'm sure they'd love to answer your questions. Have a great day.